Who wants to know about antifungals? What a great topic. So let's talk about antifungals. I'll break it up into two categories. The first one is going to be for yeast, and then I'll do another video separately for mold. So it's important to distinguish between those two when you're treating someone for what you suspect is a fungal overgrowth, because even though they're in the same family, they're different organisms, they have a different life cycle, and they require different medications to be eradicated. So we'll talk about yeast first. Yeast are budding organisms, they're single cell organisms, and if they start to overgrow in your intestine, they're going to ferment, they're going to produce carbon dioxide. That's the gas they produce. So it's not going to get picked up on a SIBO test. And the way I see it happening is you go through your GI Janel One powder, you do the titration, you do the 8 weeks at the full dose. If you still have some residual symptoms of gas and bloating, has to be those symptoms, that means that the powder just wasn't strong enough to eradicate all of those species. So your options are, you can do it longer at the full dose, or you can switch over to an antifungal treatment. So let's talk about the two safest antifungal treatments. The first one is nystatin. Nystatin's been around for a long time. The sun just came out in Seattle. That's nuts. Nystatin's been around for a long time, and that means that there are many yeast species that are resistant to nystatin because they've just seen it and they've developed resistance. So that's one option. The other option that's very safe is amphotericin B, using it orally. Now you have to get it compounded if you're using it orally, because the prescription version of it is only used intravenously, only in hospitals when people are really, really, really sick. As a last resort. They're really sick because they've got yeast that's spreading throughout their system. So those are the safe options, and they're safe because they stay in the tube of the digestive system. They don't go into your body, so you don't have to get rid of them through your liver or through your kidneys. They're going to just dump right out the other end of your system, and they'll be concentrated where you want it. The third anti-yeast treatment is fluconazole. That's an azole category drug. That means that it will get absorbed into your body from the tube of the digestive tract, and so you have to track people's liver while you're using it to make sure that their liver is safe to use this medication and continues to stay safe. So we're going to use these medications for a minimum of 3 months before deciding we're going to change gears and use a different one, or do some more testing, or try and figure out if there's something else going on, because it takes at least 3 months to get at these species. They're very, very resilient. They have many ways to adapt in order to keep their life cycle going, keep their families alive inside of you. They love it in there. It's beautiful. It's warm. It's safe. They get a constant food source. Even if you're not eating, they're still getting a constant food source from the cells that you're shedding off the intestinal wall. So they're happy. They like it. They don't want to go. And they've got many, many mechanisms that they've developed for survival. Okay, so that's yeast, antifungal yeast treatments. And next we'll move on to molds.